The patient is a male 18-year-old high school football player, and his mechanism of injury was a fall on an outstretched arm during play. Clavicle is a long bone located between the sternum and the scapula. It connects the arm to the body. During the surgery, the bone fragments are first repositioned into their normal alignment, and then held in place with a special screw and/or by attaching metal plates to the outer surface of the bone. During phase 1, the goals are to control pain and swelling, protect the repair, prevent shoulder stiffness, and maintain elbow and wrist range of motion. The patient should be wearing a sling at all times. Patients should start with a pendulum exercise in which they lay prone on a table to stabilize their shoulder. They should let their arm hang down toward the ground and make small circles with their hand to let momentum move the arm effortlessly. Next, the patient should perform multiple isometric exercises to strengthen the triceps and rotator cuff. For an isometric tricep exercise, the patient should rest the injured arm on a table for 90 degrees and isometrically contract onto the table. Another isometric rotator cuff exercise to facilitate external rotation, the patient should stand sideways along a wall with their elbow at a 90-degree angle and then place their outside of the forearm against the wall. They should contract their muscles for 5 seconds and repeat 5 times. To facilitate shoulder extension, the patient should stand with their back to the wall with their elbow at a 90-degree angle. Next, they push their elbow and arm into the wall while contracting their muscles for 5 seconds and repeat 5 times. To facilitate shoulder flexion, the patient should stand facing the wall with their elbow at a 90-degree angle and then make a fist and put it up against the wall. Next, they press their fist into the wall while contracting their muscles for 5 to 10 seconds and repeat 5 times. To maintain cardiovascular fitness, the patient should use a stationary bike, recumbent or regular, to avoid shoulder motion while still exercising. This should be continually progressed throughout the rehab process, and eventually jogging and running should be implemented within the program. In week 2, shoulder range of motion and active assisted range of motion should be initiated. An exercise could be the active assisted wall crawl, in which the patient should face the wall, simply walk their fingers up the wall as high as they can without too much discomfort in the shoulder. Each day, the patient should progress this and do a bit more. For an abduction range of motion exercise, the patient should use a T-bar and start off gripping the end with the hand on the injured side and also with the uninjured side at the bottom of the T-bar. Using the uninjured arm, the patient should go as high as they can until they feel their shoulder starting to get tight. Once the patient gets as high as they can, they should let the tissue stretch for a second and then lower their arm back down and repeat. This exercise should be performed in 3 sets of each of 10 repetitions.
Next, we progress to phase 2, where the goals are to increase range of motion exercises and begin full active and passive motion. We start the exercises with light resistance. An exercise that can be performed is the pulley exercise, which consists of a resistance band attached to the top of a door hanging down, while the patient grips the end of the band and pulls it down slowly and bringing the band back up. This exercise is performed with 3 sets of 10 repetitions at a time. Another exercise that strengthens the rotator cuff is one where the patient should lie on their stomach on a table and put one arm out at shoulder level with their elbow bent to 90 degrees and the hand down. Keeping their elbow bent, they should slowly raise their hand and stop when their hand is level with their shoulder, and then lower the hand slowly. The patient should repeat this 10 times in a row. A second exercise that strengthens the rotator cuff is one where the patient lies on a table and places their upper arm at their side with their elbow bent to 90 degrees and their forearm resting against their chest, palm down. They should next rotate their shoulder out, raising the arm until it is level with their shoulder, and then they should lower the hand slowly. The patient should repeat this 10 times. A third exercise that can be performed to strengthen the rotator cuff is one where the patient stands with her arm slightly behind her body with both thumbs pointing down. She should raise her arm up, pretending that she is emptying a can with her hand, and then lower the arm down slowly. The patient should repeat this 10 times in a row.
The patient lies supine with their legs bent and their shoulder externally rotated 90 degrees. They then lift the dumbbell and then lower slowly. This should be repeated in 3 sets of 10. The goals for Phase 3 are to continue to progress strengthening exercise program, increase weight used in previous strengthening exercises, while adding some closed kinetic chain exercise. An upper body plyometric drill would be a push-up. This exercise is performed when the patient is in a prone position and they raise and lower their body using their arms. The patient should perform cardiovascular exercises in order to maintain cardiovascular fitness to progress to game speed by biking, jogging, or walking. At this phase, the patient should begin sport-specific activities, such as throwing a football a short distance while not moving, and then progress to passing to a longer distance to a moving person. The patient then will proceed to have a follow-up with their physician. At the end of the rehab, between 12 to 16 weeks, the physical therapist should reevaluate the patient and reassess all objective measures, such as range of motion. The normal ranges of motion that the patient should have after rehabilitation should be 180 degrees of flexion, 45 to 60 degrees of extension, 70 to 90 degrees of internal rotation, 90 degrees of external rotation, and 150 degrees of abduction.